Hip arthritis is when you have the cartilage on the end of the bone wear away. Cartilage is the protective covering of the bone, and it prevents pain. When you lose the cartilage on top of the bone and the bone underneath starts to rub bone on bone, that's where the pain of arthritis comes in. And it can be very painful and limiting with your function. Types of hip arthritis, the most common type is just osteoarthritis. It's kind of typical wear and tear arthritis, but there are a subclass of patients that might have an inflammatory type of arthritis, such as rheumatoid arthritis. There are also people that have had trauma to their hip. Maybe they've dislocated their hip, maybe they've had a fracture of the socket or their hip joint, and that can predispose them to arthritis as well. Risk factors would be, if you've got a history of rheumatoid arthritis, it could affect your hip. Sometimes taking steroids as well can cause a condition called avascular necrosis of the head of the femur, and that can predispose to development of arthritis as well. Obesity, unfortunately, is a risk factor, and that's very prevalent in our society. It changes the chemical environment in the body, and it's kind of destructive to cartilage. And then with the added weight that you carry around, the cartilage isn't quite as healthy with the obesity, and so it wears away quicker because of the added weight that we're carrying around. Pain is the primary symptom limitation in your function. You have pain when you stand or walk too far, overexert. Sometimes hip arthritis gets so significant that even at rest, even laying in bed or trying to sleep, you can have some aching pain in that hip. Sometimes you'll have mechanical symptoms, popping or clicking, or sometimes a feeling of giving way. It's almost like the hip's going to give out on you. And some people complain that they've fallen a time or two because the hip just is so intensely painful intermittently that it almost causes them to fall. Typically, the first diagnosis would be the history from the patient. They would talk about their symptoms, and it would match up with the typical symptoms of hip arthritis. They've got pain, they've got limited walking ability. Typically, the pain of hip arthritis is in the groin area. They feel it in the front of the hip. You start to lose your ability to stand and walk comfortably. Treatments start with non-operative treatments. The typical anti-inflammatory, Motrin, Advil, Aleve, take some Tylenol arthritis. Activity, precautions, be careful what you're doing. If you're overexerting the hip, maybe back off on some of the activities that directly affect your hip. The next order of business could consider hip injections, cortisone injections into the hip joint. That's a little harder injection to do. It's not something we really do right in the office. We typically need a fluoroscopy unit to be able to guide the needle down into the hip joint to make sure that we get it into the hip joint. But that's typically, it helps us with the diagnosis if there's some uncertainty whether that hip is really the cause of the pain. If you do a cortisone injection, the pain goes away at least temporarily for a couple of weeks to a couple of months. That helps conclude that it is hip arthritis. But invariably, typically the pain comes back after an injection. The final treatment is hip replacement, and it's an amazing surgery that more and more patients are choosing to have done every year. It's basically when we replace the socket with a metal and plastic socket. You prevent the bone from rubbing on bone by changing that bearing surface to metal and plastic or ceramic and plastic. It's very durable, lasts for many, many years. And most patients that are really limited with hip arthritis, they are so pleased after that hip replacement, they've got their life back. They can again enjoy life and stand and walk and do the fun things that they want to do.